Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
We're talking skin cancer today in Neighborhood Health Watch. It's a diagnosis no one wants to hear, and it can be scary, but information is power. Skin cancer is the most common form of malignancy, and more than 5 million people are treated for skin cancer in the U.S. every year. Skin cancer takes many forms, and that's why understanding and knowing when to go for help is critical. And we are happy to have Dr. John Turner with Chippenham Johnston Willis Hospital on the news at 4. This, I would imagine, is the time of year when people are putting on shorts and wearing swimsuits that they notice something strange going on with their skin.
Absolutely.
What are the symptoms?
Well, there's a couple of ways to look at it, and there's a number of types of skin cancer, but the one we worry about most is melanoma, and that's the one that's often associated with pigmented lesions or darker lesions. There's a couple of things to look for, but the main thing is lesions that change. So it requires someone to have a little knowledge of their body, or someone who looks at their back all the time or something like that. But really, if you've had something for a while and it's dark and it's gotten darker, or it's changed in some way, an edge has changed or something like that, it's probably time to get someone to look at it.
Is there reason to panic and be scared? And do people tend to follow up once they see these strange things happening?
Well, you never want anyone to panic, but I think it's a reasonable scenario to have someone look it over. A skin exam is essentially a painless thing to go through. Not everyone who goes and sees a doc about a worrisome skin lesion gets a biopsy, and even that's relatively painless. So,
and is that how the diagnosis is made?
Yes, ma'am. Usually what they do is they'll examine it, and there's a number of ways to do that, but they'll take a little piece of it, look at it under the microscope, and try to give you an idea what they're working with.
What about treatment? Once you are diagnosed and the doctor says it's skin cancer, what are some of the treatment options?
Well, in most cases, the most common forms of skin cancer, that's all you have to do is you have simple surgery and it's gone, and it really shouldn't bother you from then on out. There's some more serious forms of skin cancer, the ones that keep us up at night, that can result in things downstream and even chemotherapy in some cases, but that's rare. Most skin cancers, simple excision, you end up with a little scar, but it won't affect you down the road.
And very quickly, Dr. Turner, what are some of the things that we can do to prevent this from even happening?
Well, the easiest thing is to stay out of the sun during peak times during the day. So when you're going out in the summer, go inside in the middle of the day, but also wide brim hats, guys. I know you like the baseball caps, but get the ears covered up and use sunscreen and reapply it. Awesome. One dose doesn't work.
Awesome. Thank you so much.
Well,
Valuable
you.
information. We
Thanks for
appreciate it. Sabrina?